Do you know what acute pancreatitis is and how it affects the body? This condition, characterized by the inflammation of the pancreas, carries a mortality rate of around 12%. There are numerous causes of acute pancreatitis. These include the consumption of ethanol, which is the second most common cause, and gallstones, which are the most common. Other causes can be trauma, steroid use, hyperparathyroidism, serum albumin, mumps, autoimmune disorders, scorpion venom, endoscopic retrograde cholangiopancreatography, also known as ERCP, and certain drugs, including oral contraceptives. Now, how might you recognize acute pancreatitis? The clinical features can be quite telling. Patients often experience epigastric pain, which radiates to the back. This pain tends to be aggravated by lying flat and can be somewhat relieved by sitting forward. Nausea and vomiting are also common, along with dehydration and tachycardia. You may also notice Cullen's sign, Gray-Turner sign, and symptoms of tetany, such as stridor, carpopetal spasm, and fits. Acute pancreatitis can lead to a host of complications. These include shock, acute respiratory distress syndrome, disseminated intravascular coagulation, thrombosis, hyperglycemia, tetany, ascites, metabolic acidosis, pancreatic cyst, pancreatic abscess, chronic pancreatitis, fistula, and recurrent pancreatitis. So how do healthcare professionals diagnose this condition? They start with a complete blood count, looking for a total leukocyte count greater than 15,000 per microliter. They also check the serum calcium and albumin levels, as these tend to be low. The renal function tests, specifically urea and creatinine, are often high. A chest X-ray, a CT scan, and an ultrasound of the abdomen may also be ordered to visualize the edematous pancreas. Treatment of acute pancreatitis typically involves admission to an intensive care unit. The patient is asked to fast and is closely monitored. A nasogastric tube and a catheter may be inserted. Analgesics are given for pain, and celiac block may be performed. Parenteral nutrition is provided, along with albumin infusion and insulin administration. Positive inotropic drugs like dopamine may also be administered. ERCP can be both diagnostic and therapeutic. In some instances, open surgery may be necessary. This is indicated in cases of fistula, abscess, or necrotic pancreas. So, to recap, acute pancreatitis is a serious condition with a wide range of causes and symptoms. It can lead to numerous complications, and diagnosis involves various tests. Treatment is comprehensive and may include medication, ERCP, and even surgery in some cases. Understanding this condition is key to managing it effectively and improving patient outcomes.